Okay, today we are going to be presenting a presentation which is going to assist the nurses with their start of care assessments by demonstrating the way of using a guide, an Oasis assessment guide that pulls you away from the Oasis form itself to being able to obtain information in a rather quick and an easy way by using a map to provide the information that you need in order to answer the questions without actually going through every single question. The patient here is Harry Purdy, the nurse is Karen Dunhill, and the daughter of the patient is Dina Montalvo.
Hello. My name's Karen. I'm a visiting nurse with St. Joseph's.
Oh yes, welcome, welcome. Come on in.
Go.
Your name is?
My name's Karen.
Hi, I'm Dina, and my father is Harry, and he's in the back. But I'm not sure if it's better for you here or over there. He's more comfortable there.
Okay,
Just-
yeah, wherever he's comfortable, it's
Okay.
fine.
Okay. Dad, the visiting nurse is here.
Hi, Mr. Clawson.
Hi.
My name's Karen. I'm a visiting nurse with
Nice
St.
to meet
Joseph's.
you.
Nice to meet you. Glad to be home.
Yeah.
Yeah. Do you guys have any discharge papers from the hospital
I
or
do.
any
I
of his
have
medication?
yes.
Okay.
Yes,
That's
medication.
usually a good
yes.
place to start. Can I have a seat?
Yes, of course.
Okay.
Please, go ahead.
Have you ever had home health before?
Yes.
Have
yes. I had a back surgery before as well.
Oh, okay. How long ago was that?
That was about 6 years ago.
Okay. Have you had any hospitalizations prior to just going in for your surgery?
None recent.
No? Okay, so that was an elective surgery that you're in for?
Yeah.
Okay. All right, did you have St. Joseph's when you had home health? Do you remember if it was?
You know, I don't remember.
No? Okay. It's going to ask you to sign our consent form, and if you have your ID, your insurance identification.
Oh, okay.
Do you need some help with that, Dad?
I think I can do it.
Okay.
Oh, thank you. Okay, that looks good, and it's Dr. Let's see here, Doctor. Was it Dr. Moose that did the surgery?
Dr. Moose.
That's your surgeon? Okay. He's the one that's asked us to come out and see you, and he's ordered for nursing and also for the therapist, okay?
Okay.
So, are you able to sign above my name? This
Thank you.
is that you're agreeing that we can bill insurance for our visits. And after our... Okay, that looks great. Thank you. Do you have your medications
Yes,
with you?
we do.
Okay.
Yes, we have everything.
Great, thank
we
you,
need.
Dina.
Okay. There's a few more. And my brother, who's the main caregiver or contact, he takes care of all the medications. And everything,
Okay.
so, you know.
Does he put them like in a pill box? He prepares
Yes,
them for
yes,
him? Okay.
yes.
And can I have my pen back? Great, thank you. And these are your discharge medicines, okay? And, oh, you even have the date that you started. So the one for his blood, the diabetes, that's a new medicine for you. Do you know if he's checking his blood sugar at all?
He's just started, yeah, because that is a new diagnosis.
How often does he check his blood sugar?
Twice a day.
While she's going over the medications that the patient has taken in the past and then what were the discharge medications now that is from the hospital, She would also be explaining about the patient handbook. She would be going through the Medicare secondary payer worksheet for all those patients who are Medicare fee-for-service or Medicare Advantage patients. And this patient is a Medicare Advantage patient, so therefore she would be doing that. But we're not going to show that. She would also do the advanced directives, which I may have just mentioned. And at the end, the other form that we will do is the NUMNOC, the Notice of Medicare Non-Coverage. And that will be done at the end once she knows what her frequency is planning, what the plan for the frequency will be.
Dina, on some of his medications, the information that I have is a little different from your discharge paper.
Mhm.
Do you know, like, his medication for Parkinson's is Senemet, and it says for him to be taking 2 tabs every day, and the information I have is that he should be taking it 3 times a day.
Gosh, that's really difficult for me because like I said, my brother is the
Okay.
contact, and he takes him to all his doctor's appointments, set up the medication, anything that he needs. So I really don't know.
All right, maybe we should call the doctor and find
Okay.
out what dose he wants him on, because
Okay.
when you're in the hospital, they may have adjusted that, so we'll try and clarify that.
Okay.
Okay, on the Vicodin, that's the medicine for pain, and the dose that they've increased his pain medication, and I was just wondering how often he takes something for pain?
Well, right now it's just been every 6 hours.
It is?
Yes,
Okay,
yes.
okay.
And I think that's labeled there.
Okay. All right. And are you able to see that label at all? Can you read that to me? You see that?
May cause dizziness.
Thank you. All right, and did they give you a flu shot when you were in the hospital?
Yes.
For influenza, you did have that? Yeah, okay. And let me get your vital signs, your blood pressure. Okay. Mr. Clawson, where's your pain at when you have pain?
In the back.
In the back? How would you rate it on a scale of 1 to 10? Would you say,
It's say maybe 5.
okay, right now it's about a 5? Yeah? Is that the best relief you get, or does it get any better than that?
Well, it sometimes goes away.
Does it? What would you say is the best relief on a scale of 1 to 10?
Probably 0.
Oh, good, okay, all right. And what would you say is the worst pain? Does it ever go higher than a 5?
8.
An 8, okay. And when do you take your pain medicine? How would you rate it when you're thinking, if you're taking it every 6 hours, how bad is the pain when you take your medicine?
Oh, about a 6.
Okay, all right. Get your temperature. Go ahead and close your mouth. With managing your pain, maybe think about taking something when it's about a 4 instead of waiting till it's a 6, and you might stay ahead of it a little bit. It might not get as bad as an 8. Okay? And get your blood pressure. Any activities that you're interested in?
I like to go to the adult daycare center.
Oh, good. Okay. So that's something you could work towards getting back over there after you're healing up, right?
Yeah, I like that.
Can you sit forward? I'm going to listen to your lungs. Maybe put your hands on the table there. Good. I'm going to lift up your shirt. And if you could take some deep breaths for me. Can you take a deep breath? Good. How's your appetite?
It's okay. It's okay.
Okay, go ahead and sit back. I'm gonna listen to your stomach. Do you have any questions, or did they give you information on the diabetes, since that's a
Well,
new?
It's a new diagnosis, and
Yeah.
I know that his diet is real important, and to follow up on that. But there are some things, some changes that we have to make that
Okay.
maybe
Who
that's
helps him
not
with
comfortable.
meals?
My brother.
Your brother?
My brother,
And
yeah.
does he live here?
Yes.
Yeah,
yes.
okay. Do you live here?
No.
No, okay, so it's him and his son?
Right.
Okay. And then he goes to the adult daycare center. Is that like a Monday through Friday?
3 times a week.
3 times a week? Okay, good. Do you have lunch there?
Yeah, they have SpaghettiOs. I like
And your ice cream, Dad, right? Your ice cream.
I like the
Ice cream, that's good. With the diabetes, that might have to change to sugar-free options. Okay. Well, with the new diet information for diabetes, maybe I could have a dietitian come and talk to you and your son about meal planning and some good choices, okay? So we can keep your blood sugar stable.
Do we have to?
I think it'd be a good idea, because you have new medicine, and you don't want your blood sugars too high or too low. And that's why you have your meter, okay, that you're checking your blood sugar with, okay? So all that goes together. All right, and can I see your bathroom?
Sure.
Okay, could you take me there?
Oh, okay. Dina, can you show it?
Yes. Well, and the walker hasn't come. It was supposed to be here today, so he
okay.
has the cane. But I think she wants you to get up so she can kind
Yeah,
of see where you're.
Yeah, as far as if what your needs are, how much help you need, okay? Have you had any recent falls?
No.
No? Good. So just take your time when you get up. Do you feel dizzy or lightheaded?
No.
No? Good. Okay, just go slow.
Here's the bathroom.
Oh, great. Can we go inside? I want to see how you do with getting on and off the toilet. Just sitting down. You don't have to actually. Dina?
Yes.
See how this rug, it doesn't have the rubber backing on it?
Yes.
That's a safety hazard, okay?
Okay,
The risk
okay.
for falls.
Okay.
And I don't see any grab bars in here. Take your time with getting him up and down. Even a high-rise or a commode that has arms on it would be
Okay.
beneficial.
Okay. And is that something that we can order through you, or?
Yes, yeah, we can
Okay.
call the doctor and get an order for that.
Okay.
And the therapist will also evaluate for that.
Okay.
How you doing? You feel short of breath?
No.
No?
I'm fine.
Okay.
Thank you.
Good. Okay, and then is this where you would normally bathe in the shower?
I like to bathe in the jacuzzi.
Okay.
But
We may
I
not be
can't-
able to get back in there
I
till
can't-
you're healed up,
can't
huh?
get in there now.
Yeah. Because of the surgery, or because you're not physically able to?
I just seem to have lost some strength
Okay.
since the surgery.
Okay. Do you need assistance to get into the shower?
No.
No? Okay. Go ahead and stand up and we'll see how you do with this step, if you're able to safely get in and out. Yeah, walker will definitely be of a big help.
Right.
Okay, can you see. Well, no, careful, careful, step back, I don't want you to fall. Okay, that's good. I think it's nice you got the handle, the shower handle, but there's no seating in there and no grab bars, so I think we need to make some modifications before you can safely take a bath or a shower in there, okay?
Okay.
All right. Okay, Mr. Clawson, can I have you, is this your bed?
Yes.
Yeah? Can I have you sit down and lay down in bed? I want to see how you're safely transfer, okay, in and out. And you know your back precautions, do you remember those? I need you to maybe turn around towards me a little here.
I'll remove this.
Oh, thank you,
Easier
Dina.
for him.
With your back precautions, no bending, twisting, does that sound familiar?
Yeah.
No reaching, and no bending over, okay?
Oh, okay.
Okay, and this might also be a good place for a grab bar if you have difficulty getting in and out. They have little side rails that you can get. Good, you got your shoes off. Okay, does your brother usually help him with
Yes,
his getting in
yes,
and out?
yes.
Okay. How's your back?
So it's okay.
It's okay? Alright. Alright, and then can you safely get out of bed? Do you remember how to transfer? There you go, roll. Rolling. Okay. Oops. And do you need help with dressing?
No.
No? You're able to get your clothes out and get dressed on your own?
Yeah.
Yeah? How do you manage with your socks? 'Cause
Um,
that might be kind of hard with after having the surgery. I don't
know.
think you can, you should be
I
reaching that
had
far.
help
Did
this
you?
morning.
Okay. Alright, maybe occupational therapy would be beneficial too, because they have little gadgets that would help with that, okay? So you can do it safely.
Okay.
I think until then, your son or daughter should be helping you, okay?
All right. Thank you.
Okay, Mr. Clawson, I'd like to look at your skin now. I want to take a look at your incision and look at your feet. Are you comfortable sitting here? Do you feel
Yes.
secure? Okay. Are you able to get your shirt off?
I'll try.
Okay. And do you have regular bowel movements? Are you able to go to the bathroom okay?
Yes.
Yeah. Have you had any urinary tract infections? Any difficulty urinating?
I go a lot.
Do you? Frequency? Okay. Do you wear Depends or?
No.
No? Okay. Good. Okay, and you got your back brace on? Okay, and let's get that off. And you wear the brace whenever you're up, right?
Yes.
You wear the brace? Okay. How about when you go to bed, do you take it off?
Yes.
Yeah, okay. And this might be easier if you're standing up. Let me see. Okay, go ahead and stand up for a minute. Dina, could you come stand next to him just
Yes.
to be safe?
Okay.
And take a look at your incision. Oh, that looks good. No redness, no drainage. Signs and symptoms of infection, if there was any like little hot spots, warmth to touch, any type of drainage, you would want to bring that to our attention, okay? Or call the doctor.
Okay.
Okay, and let's see, get your back brace back on. Okay, I'm going to take a look at your bottom now and look for pressure sores.
Now, when the assessment of the skin is being done, you want to start from head to toe. You want to think in terms of their head, their ears. It's a big area of pressure. Sores can develop, and we often miss it. The nose, behind the ears, this patient may have been on oxygen. and therefore they could have some areas of abrasion or breakdown around those areas. And then, of course, the buttocks. You want to look at every single patient, legs, arms, feet, and heels. You want to make sure that you're assessing all of those things, not just for diabetics, but for all patients.
All right, Mr. Clawson, your skin looks pretty good. Do you have any cuts or bruises? No?
No.
Any sore spots from IVs? No?
No.
No? Okay. All right, can you reach your shirt and put that back on? Are you able to get that? You need some help? Yeah. Yeah, I don't know if we want him reaching that much. Another option for assistance is private duty. It's where the family can hire someone to come into the home when he needs it, maybe like a 4-hour block of time on the days he doesn't go to daycare.
Okay. Is that
Yeah.
through St. Joe's? Is that your
Yeah.
agency?
Yeah,
Okay.
yeah, we have our own private duty.
And do you have a brochure or someone I can contact?
Yeah, there's something
Okay.
in the folder.
Okay.
Yeah, you can take a look at that. Okay, and I'd also like to take a look at your feet. You're doing pretty good with those buttons. Good. Okay. And let me get your socks off. Diabetic foot care is very important to inspect his feet. You may not always feel a sore tender spot or a bruise that may develop into a ulceration. So you want to check for circulation in between the toes, pressure on the back of the heel, and also look for swelling too. Okay? Look good. Get your other one off here. Good. I don't see any redness. Good. Okay, let me help you with your socks because I don't want you reaching with, after having the back surgery. That's important, okay?
All right.
Little
Thanks.
reaching.
You're real nice.
Well, thank you. And how are you feeling?
Okay.
Yeah, a little tired?
Yeah. But okay.
How's your pain right now?
It's fine.
All right. Can we take a look in your closet before
Karen,
we leave
before
the bedroom?
he goes
Yeah.
over there, is the height of the bed fine? Is there a
Um,
concern?
yeah. I think it's a good height for him. A lot of times what I notice is chairs or bedding that is too low. A lot of times we have to actually raise the bedding. So I think that height, how do you think that height is, Mr. Clawson? Let me get around him. He can't hear me.
Yeah, he's some. Yeah, there's a.
How do you feel about the height of the bed?
That's good.
It's
I like
good?
it.
Okay. All right. You don't have any trouble?
No.
Okay. All right. Is this your closet?
Yeah.
And are you able to reach your clothing okay, or does your son help you?
No.
You do it yourself?
Yeah.
Yeah? Okay. Okay, Mr. Clawson, let's see, it looks like you're having a little bit of trouble here. I think if we had therapists come out, they might be able to better assist you and show you ways to safely get your clothes and get dressed, okay?
Okay.
All right, let's go take a look at the dresser. You got the door open and shut good, but
That's okay.
you're
Dad.
having,
I'll fix that. Don't
having
worry
a
about
little trouble with getting the clothes out. Is this your dresser here?
Yeah.
Okay. And, part of this is, I just want to find out what your needs are, so that's why I'm asking you to go through all this. Okay, that's a little hard, huh? want you to fall. Okay. All right. Whoa, 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 whoa. Okay, that's okay. Thank you, sir. All right, you want to go back in the kitchen? We'll sit down.
All right.
Okay, I'm pretty sure the therapist will help with his safety
Okay.
issues. Now that I see him up and going a little bit. How were you before the surgery? Were you able to do more for yourself then, or
Oh, yeah.
yeah? You know what, that rug, that doesn't have rubber backing either, huh?
Oh, okay, no.
Yeah, that we should get rid of that. And if that's a risk for falls, there you go. Okay. And the chair situation, the height of that chair, does that feel okay, getting in and out of that?
It's perfect.
Is it? Okay. I would recommend something with arms on it, okay? That would be much more stable, getting you up and down. And then once we get your walker, that'll, you'll be safer ambulating with that.
Who do we talk to about that, the walker? And is that coming through you?
Yeah.
And then if they don't deliver it, who should I call, the agency or?
If you don't get it within the next 24 hours, usually on discharge they'll order it, so it should have probably been out here. But if it doesn't, then that's my job to follow up on
Okay.
that. Yeah.
Okay.
Okay. Yeah. And if when we get the walker out here, the therapist will come out and they'll make sure that he's safe getting in and out of
Okay.
the bedrooms and all. And the other thing I wanted to bring up is the private duty. You had asked me about
Oh,
that.
yes, yes.
This is the form that talks about it.
Okay.
Okay, and while there's a nurse or a therapist in the home, insurance will pay for bath visits, and he was not able to get in and out of the bath, so maybe we could have a bath aide
Okay.
come out a couple times a week and help out with that.
I did notice just when he was in the bath and then some of the activities you had him doing, like taking off his shirt, it seems a little less now. So
Okay.
there's definitely a change.
Okay.
I
He
just
was
really
able
didn't.
to do more on his own before.
Yeah. I mean, not a whole lot, but
Yeah,
still a lot
yeah.
more than he's doing now. So.
Okay.
I
And I
want to
see-
get it in the jacuzzi.
Okay.
Yeah.
Well, we'll work up towards that. Okay, that's a great goal to have. Okay. And I see you wear glasses. Do you wear hearing aids?
No,
No. Do you have any difficulty hearing?
no.
No. Okay.
Well, there is a slight.
Yes.
Slight.
Okay, and
Sorry, Dad.
do you have a smoke detector? You know if you have a smoke detector
Yeah.
with a,
Yeah, I have a smoke detector.
yeah, does it have a battery that works?
Yes.
Yeah.
Yes.
Okay.
Yes. We have them checked.
Okay, good. And how about a fire extinguisher?
Yeah,
Would you know where it is? Is it in working order?
it's in that closet there.
Is it? Okay, good, good. All right, and then, do you have anybody that can put in grab bars? I don't know how handy your brother is, but that might be a good
Well, there's
suggestion for
definitely,
the.
right, right.
the
We'll
bathroom.
we'll relay all that and
Okay.
let him know. after
All right,
this is-
and do you know how tall you are and how much you weigh?
5'10"
5'10"? Okay.
and 150 pounds.
Okay. Any weight loss or weight gain in the last couple months? What do you think? Is his weight pretty stable?
I think so. I think his weight has,
I think
It's
I
very
ate too
good.
much at Thanksgiving.
yeah.
Okay.
I don't know if 5'10" is exactly right, but
Okay.
the weight is good.
I know one of the medicines he takes for the Parkinson's, it's recommended to increase his protein, and that's also a good suggestion with the diabetes. So for follow-up nursing care, for sure we'll see you a couple times a week until you go back to see your surgeon, okay? And he'll take the staples out. And then we'll have the bath aide come out. The physical therapist and occupational therapy, when they come out, they'll make their own frequency and care plan. So I don't know what their how often they'll be out. And then
Good.
yeah, and then the dietitian, we'll see if we can get an order for that too.
Good.
I want to keep my ice cream.
You want to keep your ice cream? Okay. Well, there's probably a lot of good choices, so we'll see how close we can come to the real thing.
All right.
Now, so far in this assessment, from the very beginning, from the knock on the door until this point, we have utilized about 30 minutes. That's it. And an assessment can be fairly fast, and this patient is slow, and that is expected. So you need to get them into the bathroom, actually see them try to get into the shower, and as it was here, she pulled back correctly so that the patient wouldn't injure themselves, and then look at the skin assessment, see how they get on a bed, off the bed, look at transferring, that's one of the questions. It can be done in about 45 minutes, and that is not all the paperwork, which you can do immediately thereafter, but you at least have all the information at your fingertips without having to be going through each one of those questions. You need to stay focused. You need to use your assessment guide. It's a 2-page item at this moment. And if you learn it and you learn the questions by knowing the intent of the question and how that question relates to outcomes, because the agency is going to be graded on the outcomes they achieve or that they do not achieve. And it is very important that we have an accurate assessment and that we are able to, at the end, hopefully have positive outcomes. That is what a goal is, but to be accurate, not to have it made up. So at this point, now they're going to end up into the finalization of the assessment and the checking with the patient regarding any questions and going over the emergency care plan and things like that.
All right, Mr. Clawson, I'm almost done. I'm making up a care plan, and that's when the nurse comes out. Usually everybody calls the night before or first thing in the morning to schedule their visits. If you know you have a doctor's appointment, call and let us know so we don't try and make a visit on that day. We don't do both. And just to get a better idea of what your activity level was prior to your surgery, was your pain worse? Were you...
No.
No? Okay. Were you able to do more for yourself at that time?
Yeah.
Okay. Do you see that you need some assistance for your own safety?
I guess so.
Okay. Get some pointers, have the therapist come in, and I'm glad you go to the daycare center, but maybe on the days that you're home, does your brother work? Is he here by himself?
Yeah, he's
Okay.
here by himself. But I just think I'm glad to hear that this physical therapy and
Yeah.
to
Yeah, and we can have, we'll have private duty contact you and your family and see if that works into a good plan for your, like I said, your safety, and maybe transition you so we can get you back in the jacuzzi and get you,
Good.
get you more
I
active.
like that
and
idea.
Good. I have a form here. This is kind of tells how long we'll be out here, and for nursing I've projected a 4-week period, and that'll make sure that you get back to your doctors, get all healed up, and then we can always renegotiate if we're done before that date. Okay, so can I ask you to sign this again?
So
This is the-
he's signing this, but if we feel that he shouldn't be discharged or at time, do we
Yes.
contact you? or
Yes,
is there-
this is what the form is. We're
Okay.
providing you with the phone number to make your own appeal.
Oh,
If
okay.
you feel that it's, if you don't agree with it.
Okay.
You know. And then I have another form. This is our, this has really come in handy. It's an emergency care plan, and it kind of has little bullet points, and what would be specific for him is the diabetes,
Oh, okay.
and with his surgical wound and falls. Okay, and then it has when to call the doctor or the nurse, and then in case of emergency, you call 911.
Oh,
In
I
our
see.
agency, we don't provide emergency services.
Oh, okay.
But if you call us 24 hours a day, if we can't help you over the phone, then we'll try to send somebody out as soon as possible.
Okay.
But in case of emergency, you always want to call 911.
First, okay. And this was the guy? This-
Yes, yeah, and I'll leave copies of, this is your folder,
Okay.
so I'll leave copies in this, and then that tells you the phone numbers to call. And nursing, therapy, we can all be reached at the same number, and then private duty has their own contact number.
Okay. Is there someone specific that I need to ask for? or
Yes,
is there-
yeah, that would be Judy.
Okay.
She's my scheduler.
Okay.
And if she's not there, she'll call you right back. And then the manager is Marty. She's in the office, and then I'll be your primary nurse.
Okay. Did you understand that, Dad?
Yeah.
Yeah? Okay.
Do you have any questions about anything? Medications? No?
No, I think just, again, the walker, getting that, because I
Okay.
see how he's struggling,
Yeah.
and just those other things to help him, the
Okay.
grab bars and other things.
Okay, sounds good.
Yeah.
All right, great, thank
Well,
you.
thank you.
Thank you.
You're welcome.
What we were attempting to achieve here is to show you that it is a rather easy thing to actually do an assessment as long as you know what it is that you're trying to assess and that you know the questions ahead of time and that you have a plan and that you stay focused on that plan. You want an accurate assessment. You want to have fun with the whole thing. You should be attending to what's going on with the patient and not the papers. You need to know which papers need to be signed. You need to know which papers that you need to explain. But you don't want to be always into the papers. You want to understand what it is you're assessing. And there are certain things that you must assess, and there are some things that you can do by interview and you can ask. Such as at the end here, there was asking about what was his level of function prior to the surgery. This is a new question as of January 1, 2010. This is a little different. There are some other questions that are different. There have been some intent changes. You really have to master the questions, and then you are the master. You are then in charge, not somebody else, not this piece of paper. You are in charge, and that is the better assessment that will allow us to achieve outcomes. Now, all of you can enter in regards to how you thought this went and what did you learn and what did you, obtain from all of this.
Asha's assessment form, this was so easy just to follow along. It was really a nice tool to use, and I will continue to use it. Thank you.
It kind of gives you all the points to cover the Oasis questions. So if, like Carolyn and I keep saying, the Oasis is in place, it's not going to change, so you just need to master the questions. And once you kind of look at that list, it kind of cues you into all those questions, so you're not sitting in front of the patient and just answering, having them answer. You've assessed the patient, now you can go back and really fill in the Oasis and feel more comfortable with it because it's going to be more accurate. With this patient, he had a lot of balance issues. Even when he was saying he can do it, he's not safe with it. He said he could get to the toilet, he wasn't really safe with that. He wasn't really safe with the transfers in and out of the bed. He could manage to do them with difficulty. And he was in denial about hearing, he was in denial about the pain, and he's really just focuses, he's been independent, so he wants to remain independent. So that's the